From pediatricians' offices to local pharmacies, vaccine providers are wrapping up their first week of giving COVID-19 shots to kids. Across the U.S., about 20,000 providers have signed up to vaccinate children as young as 5. The Fox Medical Team's Beth Galvin has a look at how things are going so far.
The children's COVID-19 vaccine rollout is now fully up and running, and federal health officials say more than 1.5 million kids have either had their first dose of the vaccine or have an appointment to get their first shot. In the week since the first U.S. kids ages 5 through 11 began rolling up their sleeves for COVID-19 shots, White House officials say about 900,000 school-age children have received their first dose of the Pfizer pediatric vaccine.
Our goal clearly is to vaccinate as many kids as possible. This is the very beginning of the program. The program is just getting up to full strength.
Many of the pediatric vaccine providers, including pediatricians and family doctors, are new to the rollout and just coming online this week. But pharmacies have already scheduled about 700,000 appointments for children, and 114 pediatric hospitals like Children's Healthcare of Atlanta are also holding vaccination drives.
So the pace will be increasing across the next several days and across the next couple of weeks. So I think we have plenty of supply for all 28 million kids between the ages of 5 and 11.
After months in the red on the CDC's transmission map, Georgia is now yellow, indicating mild levels of COVID-19 transmission. But about 70% of U.S. counties are still reporting high levels of spread of the virus. And heading into the holidays, about 25 million fully vaccinated adults have now received a booster shot. But about 60 million Americans, including 43% of all Georgians, have yet to receive one dose of the vaccine.
First and foremost, we want to get everybody who's eligible to be vaccinated, who has not yet been vaccinated, to get vaccinated. That, I think, is the most important in terms of preventing hospitalizations and death and infection in and of itself.
It's been about 5 months since the Delta variant swept through the U.S., leading to a fourth surge in infections, and health officials say they are keeping an eye on emerging variants of this virus.
But right now, our problem is the Delta variant, without a doubt, as well as the fact that we are very alert in looking out for the emergence of other variants.
And that's because more than 99% of the samples of the virus being tested across the country are the more contagious Delta variant. For your Fox Medical Team, I'm Beth Galvin.